here in the ICU now with Courtney Boland, and Courtney is our nurse manager for our ICU here in the hospital. And so we currently have 8 ICU beds?
Yep, 8 ICU beds and 8 PCU beds.
About how many patients do we see a day?
We have been seeing every bed nearly full here as of late. We don't have less than 8 at a given time.
Yeah, it's a really busy time right now. And one of the things that, as we've been looking at census, we noticed that ICU and PCU are oftentimes at capacity or beyond capacity. So it's an exciting time for us to be expanding our ICU services. So coming soon in the new expansion, we're going to have 16 ICU capable rooms. So it gives us the ability to grow. And then all of our beds on the inpatient floor are going to be monitored beds.
Yep.
And so it really gives an opportunity for us to be more flexible and grow. Dr. Oliver, welcome, and tell me a little bit and tell our audience a little bit about what a hospitalist does and what's your role.
The model is for a provider that only sees patients at the hospital. I don't have a clinic, I don't carry primary care patients. And in that role, I am in the hospital for my entire shift, and my role is to help navigate people through the admission process, in hospital care, and then work on discharge planning to successfully hand them back to their primary care provider for ongoing care. We have what's called an open ICU model here at CMH, and so myself and my team carry patients across the spectrum from the ER to the ICU to our step-down unit to med-surg, and follow them throughout their entire hospital course.
As we think about our ICU rooms and the things that we're going to be providing to our patients, what are some of the things you're most excited about with the expansion?
I'm most excited about having larger rooms, some in-the-ceiling lifts, some new beds, and then the integrated call light system that will allow us to have a light that indicates when a nurse or a tech is in the room with the patient, and allows other staff to see who is in there with that patient as well.
Yeah, that's great. And so our rooms are quite a bit bigger in the expansion, and one of the features is that we have restrooms actually in each one of the rooms, so it gives the ability for patients to be more flexible as they're in the hospital setting. Also, we've talked quite a bit about not only are we building new rooms, but we're going to have a new complement of technology in the room. One of the things I'm really excited about is just being able to elevate what we're able to keep here at the hospital, because when patients go to other communities and they've sought care here first, it's really inconvenient for them. And so I think with the new hospital, one of the things that we're going to be able to do is keep more people home, close to home. So talk about the ICU experience for patients when they need that, and how our new expansion is going to elevate the care we're able to provide.
Certainly. So our ICU, obviously, any ICU is a representative of the highest levels of medical care a patient may need. And so we currently offer great ICU care. We have a great mixture of experienced and young nurses who have seen the gamut of patient illnesses. Moving into the new building, we're going to be able to work into larger spaces. We're going to be able to accommodate those patients even better than we do now. And we'll be able to bring on new service lines that will allow us to take care of sicker patients, ones we've traditionally not kept here at CMH, and to hopefully allow for patients and families to remain in the community for their care rather than necessarily being transferred to a larger hospital. The new ICU is going to bring about a wealth of new technology that we'll be able to utilize to help. I think the most exciting for me right now is our agreement to start with a tele-intensivist program, to have intensivists or ICU doctors on call or available for our help with hospitalists 24/7, and they will be able to remotely see, monitor, and help us manage patients which are beyond perhaps the traditional hospitalist scope of practice.
Yeah.
And in addition to that, being able to then bring on new service lines, whether that's through our pulmonary critical care program, our nephrology program, our cardiology program. There's patients that we've traditionally not kept at CMH that we will start to be able to, and that will be great for the patients and for the community.
I know you've been working on plans with the new ICU with your staff. Anything the staff's told you that they're really looking forward to with the expansion?
They're looking forward to more computers, more desks to sit at, or stand at, whichever. Currently, in our situation, we just have the one little ICU desk, and in the expansion, we'll have a desk between every 2 rooms. And so they're really excited about that, and respiratory is really excited to have their own place in our area. When patients need ICU care, it sometimes is a really hard time for the family and for the patient. And I know and have confidence every time we have a patient here in the ICU,
they're getting the best care. And so thank you, and thanks to your team for the great care we provide here in the ICU.
Well, thank you.